Hey guys, Dr. Michael Derry here today. So I'm a doctor of physical therapy and I run through exercises all the time to help people loosen up their stiff lower backs. And so that's what I want to go through today with my buddy Roy. He has no idea what we're about to do. He hasn't done this stuff before. So I think this is a great time that we can learn these exercises, learn what they should feel like and how to do them. And in the description, I'll put the parameters I typically do. So like the reps and sets. But we're just going to go through these exercises today to loosen things up, to help you get your day started off well. So you're gonna want to get on a table, you're gonna wanna either get on the floor or a mat and just listen to me and run through these exercises. And the key here is just to listen to your body. So we're gonna work up into restrictions, but we're not gonna work past them. These are intended to loosen up your back, not to make you feel worse. And so we're gonna go through these together. We're gonna hit all 5 of them. We're gonna hit all of the ranges of motion of your spine, flexion, extension, and rotation. So let's get to it now. I hope you guys enjoy how you're going to feel. Here we go. All right, like I said, we got my buddy Roy. We're about to hit just some really good stretches. We're gonna start off here on our hands and knees. It's called thread the needle. So I'm gonna have him get on his hands and knees here. So his hands are gonna be right underneath his shoulders and his knees right underneath his hips. He's gonna have what's called the neutral spine here, so he's not poking his butt out or tucking it underneath him. He's just in a neutral position. And then the thread the needle, so he's gonna stabilize with his left arm, reach through with his right underneath his body and feel that nice thoracic rotation and lumbar rotation, and then come up and reach up in this direction. Come back down. He's actually pretty good here, I love it. And so he's gonna reach through, get that nice thoracic and lumbar rotation, and then move up into the opposite area of rotation. What's really cool about this exercise, keep going, is that we're going to get a little bit of passive stretch here, and then definitely some active stretch. I know Roy is feeling some activity. This one usually gets us nice and warm. And so I love this exercise because it's such a bang for your buck exercise. It works a lot at once. We'll switch arms here. And if you can tolerate it, you could be on your knees. If you can't tolerate it, you're gonna reach under with your right, good, and go up. If you're having a problem with your knees, you can always just stick a pillow underneath your knees, no big deal. Now, some people ask me, like, do you do all the reps on one side and then switch, or do you switch as you go? It's really your choice. I think just listen to your body and see how it feels. Now, let's say Roy had a really hard time rotating one way or another. That's completely normal. And I would just tell him to just listen to his body throughout and just reach through again with this arm here. Okay. And then come out. The key too with this is looking with your head. And so you'll notice his spine, his cervical spine is following his arm. And that's exactly what he should be doing. You can relax. So he's a natural athlete, so he's kind of getting it right away. And it's okay if it takes you some reps to get through it. That's completely fine. That's completely normal. And now we're gonna move into the other exercise. It's called the world's greatest stretch because it hits your hips and your back and different parts of your spine, your lumbar spine and your thoracic spine at the same time. So he's gonna be in a big kneeling position. He's gonna stick up one leg all the way up on the table, forward, yep, all the way forward. And then he's gonna extend that back leg good. He's gonna sink into his hip here. You can see all of that range of motion he has. He's gonna brace with the opposite arm. So his right leg is up, so he's gonna brace with his left and rotate towards his right side. Like that. So he's getting that extension again, but this time we're able to work into the great hips, go back down, and then you're gonna go back up again. Now this one I typically recommend doing, all one side, just so you don't have to switch back and forth, but again, it's really your choice. Beautiful range. Now Roy has no signs of arthritis or degeneration here. He's looking good, so he has tons of range, but it's still a really good way for him to loosen up his upper and lower back, and I know he's feeling good here. We'll do one more on this side and switch it up. World's greatest stretch for a reason. Now we're gonna go to the other side. We'll at least do 5 reps here. Give him what he deserves. He's gonna have that big range of motion here. Left leg forward, right leg or right arm stabilizing, rotate with the left. Right there, good. I know he loves this one. You gotta appreciate the hips here. Like that left hip's coming up, getting into that deep range of motion of hip flexion, and that back leg is getting into that deep range of motion of hip extension, which is a great way to start your day or warm up to help you with that stiffness that you may feel in the beginning part of your day. Bingo, good 5 reps there. Now he's gonna bring the other leg up again. We're gonna move to our third exercise here, which is called a pigeon pose, which is fairly typical, but it's still a great stretch. So he's gonna be in a similar position. Right leg is up, Left leg is back, but this time this knee is gonna be on the table. So we're gonna swing that foot down. Yep, bingo. So that it's gonna be down here. And what he's going to do now is he's just gonna think about pulsing his chest towards the table. And he's gonna feel that glute open up here. You should feel this right into the glute, right into the meat or the back of the butt. Do you feel that?
I do.
It's a great stretch to work into that external rotation of the hip. And once you max up that external rotation, you're gonna get a good amount of lumbar flexion as well. And that lumbar flexion feels so good. Now, since he's doing so well here, I'm gonna have him sink his hips back a little bit and we're gonna swing this foot up this way. Yeah. And you're gonna feel a difference with that hip external rotation. You feel that one?
I definitely do.
We also did a little workout yesterday, so he is going to appreciate the way he feels after this because I gave him some soreness. Perfect. All right, let's switch sides here. So let's get that other foot up. Good, perfect positioning, good. Now, not everybody has a table, and I can appreciate that, but just get on the floor of the yoga mat. Good, that one still looks really good. He's actually gonna come up a little bit more. And yeah, there we go. Sink into that hip. So this side's a little stiffer for him. I can tell that that gap here from his butt to the table is a little bit higher. And so he's just gonna pulse into that range and come out of it. It's completely normal to have a side-to-side difference in feeling. It's just kind of your body, and your body will tell you where to go and where to stop. Now, some people like to go here and hold. I like to just pulse into the range because it's more comfortable. And the last thing I want is your body to be guarding and really not enjoying being in that stretch and position. So the intent here is to improve stiffness and improve mobility. And so we want to just pulse into that range. Very good. Now let's dive right into the lower back here. So he's going to stay in that similar position, but swing this leg back. He's going to lay on the table and just relax for a moment. Bingo. He's going to bring his hands kind of ear level right there and about shoulder width apart. And then he's going to keep his back super relaxed, but press his arms up, get his arms as straight as possible until I see his hips start to leave the table. And then he's going to right there relax and go back down. Man, he has got a good looking spine here. And so he's going to press up right there, and he should feel pressure right in this region here. It's completely normal to feel that lumbar extension. With everything we've done so far, we've kind of worked into flexion and rotation. So now we're working into pure extension of the lumbar spine, this is called a press up. And he's doing really well keeping his glutes relaxed. And that's gonna allow him to focus and really feel that pressure in your back. Now, some people right there is, that's as far as they can go before they start to feel pressure in their back. That's completely fine. You find your range and pulse up into that range. Come up and breathe out. Come up and breathe out. Yep. So this is a great way to help improve lumbar extension and to really get after that stiffness quickly. This is safe for arthritis, degeneration, disc stuff. Like, you've just got to learn your body. This should never ever make you feel worse. And when he gets up here, he's going to be feeling a lot better. And speaking of getting up, we're going to move into our last exercise, which is a standing exercise, and it's called the RDL, which kind of brings it all together. Let's go. Okay, so we're going to move into our very last exercise here, and this is called the RDL. And so it is that. So the last ones were more of stretching and mobility. This one is definitely an exercise, but it combines length and strength, which your back and your spine and your hips crave that in the mornings or when you're feeling stiff. So we're gonna go over that correct form now. Now remember, I'll put the dosage in the description, but we're gonna focus on form because form is super important and I really want you to feel it in the right places. So Roy here he's gonna brace himself on his left leg, and as he goes down, his right leg's gonna come up and he's gonna reach down with his right arm. And so it is right there. That's pretty good. Keep going, Roy, and I'm just gonna help talk you here through. So I do want him to keep his lumbar spine fairly extended. So think about bending down through your hip and keeping your back nice and straight there. Now, when Roy goes down, we're gonna ask him, where do you feel it? Where do you feel it?
Definitely feel it.
Yeah?
Lower back here.
Perfect. And you should feel it in your hamstring as well.
Definitely.
Okay, come back up. So what I tell people, if you haven't done this before, stop when you feel the pull in your hamstring. So go down, feel that pull in your hamstring, and come back up. What we also don't want to see, keep going, is this hip open up. We don't want to see that. We want to keep that hip nice and square, and as he bends over, Bingo. He's reaching towards. Now over time, I would really want him to start keeping his back extended, like kind of like poking his butt out. And he's not going to be able to go down as far. A lot of people really want to go down as far as they can, but when you do it right, your range of motion will be limited from your hamstring. So go back down, right there. Good. And what I tell people to help them through this is when they reach down, try to reach down towards your big toe on the other side. If you reach down towards your big toe, you're going to feel that in your hip sooner. There we go. But he's going to want to keep that back super extended.
There we go.
There we go. Switch sides for me. So let's loosen up that right side here. So he's going to stabilize on the right, and then he's going to reach with the left arm. Good. Good. Form looks perfect. He looks good for the first time doing this. It looks amazing. He's going to feel that good pull in his hamstring. He's not open up at his hips too well. But I really like about this is Roy hasn't done this before, and he's still able to get that good mobility work in his hip, his hamstring. And a secondary benefit here is that we're moving his sciatic nerve, which is amazing. That big nerve that comes out of his glute and goes down his leg. That's what that big pull is in your calf and hamstring when you do this. Also, if you feel like your balance is off, please stand by next to something sturdy, like a countertop or like this gym equipment here. Not a balance exercise, it's a mobility exercise, so I want you to feel more mobile. All right, thank you. So we went over 5 great exercises that you can use to start your day. A good amount of reps, and all of those are gonna help you feel super loose and just get your day started off right to help loosen up your hips, your lumbar spine, your thoracic spine, and just your entire spine. So guys, try that out. Look into the description and find the details of the reps and sets. And of course, leave some comments if you guys have anything you would like to add. And thank you for supporting the channel. Subscribe if you would like. But as always, guys, stay healthy, keep moving, and take care of yourself.